Many patients naturally wonder when they can sit down following their BBL. It's a good question, as sitting too soon can impact the healing process and even the final results of the procedure. In this video, we will discuss when it is safe to sit down after a BBL, as well as some tips and tricks to make you rest more comfortably. After your BBL, you will need to take some downtime to allow your body to heal. You may experience side effects such as swelling, bruising, and tenderness around the buttock, as well as in the areas where the fat was extracted with liposuction. This will make sitting uncomfortable as well as a bad idea for the healing. The reason it's important to avoid sitting in the initial stages of recovery is because it takes several weeks for the injected fat in the buttock to stabilize and connect to the body blood supply. When you sit down, you reduce the blood circulation to the buttock, which can prevent these connections from being made, causing fat cells to die, which can impact the final results of surgery. Sitting down can also cause the fat cells to shift position, causing the buttock to become distorted. You will therefore need to avoid sitting down and putting direct pressure on your buttock for at least the first 3 weeks after surgery. After 3 weeks, you should be able to sit down without the need for extra support. If you're worried about sitting after your BBL, try adapting your daily routine without sitting directly on your buttocks using our tips and tricks. It should be safe to drive 2 weeks after your BBL, but it's generally recommended to wait until you're fully recovered if possible. If you do need to drive, you can use a special BBL pillow. This is placed underneath your thighs to enable you to sit down without your butt touching the seat directly, preventing excess pressure on the area. Most patients return to work around 2 to 3 weeks after surgery. For those working at home, you may feel comfortable lying on your stomach or standing to use your laptop. If you're going back to the office, you may benefit from using standing desk if they're available. If you must sit down, use the BBL pillow for your comfort and safety as you heal. As well as your sitting position, you will have to adjust how you sleep and avoid lying on your back or sides. Instead, stick to sleeping on your stomach and use pillows on either sides of your body to avoid rolling over. It's important that you also use adapting sitting positions that you can use for up to 20 minutes at a time to prevent you from putting too much pressure on your buttocks. Try practicing these techniques before surgery to make sure you are prepared to adapt your positioning as you heal. One technique you can try is elevated butt sitting, where you can sit on your thighs while leaving your buttock suspended in the air. To get in this position, place a BBL pillow or an elevated cushion on your chair and then sit on your thighs down until comfortable. The second technique you can try is edge backward sitting, which requires a chair with no arms. With this technique, your front will face the chair back and your legs will fall either sides. This keeps the pressure of your thighs off your buttocks. Hopefully, this quick guide to sitting after a BBL has been informative and relieved any concerns you might have leading to the surgery.